I don't know if you guys are experiencing it up there, where I guess people are afraid of being diagnosed with COVID-19. Like they feel like they're going to be treated negatively or something, so it's almost like this stigma that's perceived, that that people are going to look at me differently or treat me differently because I've had it and I've survived it. Whereas I would think, wow, like I'd be singing, like I said, I'd be like you, like, yay, thank God, I'm done. Oh God, great, look, I'm done.
Right.
I want to test. Oh God, I would love to test antibody positive, and be able to say that I've
Well,
had it and didn't know.
I was very transparent with my patients.
Mm-hmm.
My patients knew that I was out. They didn't necessarily know why when I was sick, but when I came back, I said, yeah, I tested positive. I was sick. I tried to explain how I think I got it, um, just by way of informing people and sort of saying, be careful yourself. It's not necessarily that one exposure, that one person who you don't know, but it may be a series of small exposures that takes you down that road. So I do always talk to my patients, and I was very honest about it. But I think I'm in a unique situation where I'm a physician,
Right.
and my job was not affected. My family still, wanted to be with me, and I mean, I was banished to the guest room for a month, but and that was tough. The isolation part of this is very, very tough. So you can imagine that there are people whose jobs are on the line, or people who are so afraid of this isolation. And isolation is real. People don't want to be around you if they think that you've been sick, because there's that fear factor of,
I don't want to
it's
get it.
like, you have something and I can get it. And the reality is that they can. So they're not unfounded in their concern. So what I try to do is take concern and not let it get to fear, not let it get to paranoia. So yes, there is a bit of a stigma, and I think when you look at, especially in Brooklyn and some other places where people are not divulging whether they've had it or not because they're afraid of what people might think.
Right.
It's silly to a certain degree, because everyone's getting exposed to this. It's not like you did anything
Right.
to expose yourself.
Right.
Yeah.
It's
But
not because you're unclean. It's not because you're
exactly.
a certain race, or that whether you're rich or poor,
No.
or whatever. Immigrant, not immigrant. It has nothing to do with that. We were talking, and there's in several different areas in the country, the numbers of minorities, of black and brown people that are getting the virus and are dying of the virus are much higher. And so there's been a lot of concern with that. But when you look at Florida, per se, our numbers aren't necessarily ferreting that out. At least now, I did not look closely at Miami-Dade. So I'm unfortunately got to chop them off because I don't want to give out wrong data information. But at least for the rest of Florida, our numbers are not actually panning that out. So you cannot assume that, oh, okay, well, if I'm a upper middle class Caucasian, that I don't have to worry about getting it. So I think that, as I always tell people, everybody should assume that everybody's positive until proven otherwise. And that's how I treat everybody that I come into
And that's what we're
contact with.
doing in our offices. Yeah. That's what we're doing in our offices. We're screening everyone. We're doing a screening in terms of asking questions on the phone before patients come in. And then when they do come in, we've limited so that there really isn't more than one person in our waiting room at one time. And because we have several exam rooms, we try to keep the flow. And our medical assistants have really worked it so that as one person is leaving the surgery, you don't leave through the same door that you came in through. So we've changed our workflow, what we call our workflow. And so that way people can come in and leave and not necessarily be in contact with each other.
Right.
So minimizing patient contact with other patients. And then, of course, our staff is well protected, and we clean up, we clean behind every patient.
Oh
So
yes.
making sure that the office is as clean as is humanly possible. And but
Yes.
it's a lot to change. It's a lot to get used to. It's not the way we used to work. The way we interact with each other, the way, we're everybody's very close, and we're always hugging and,
Yeah, and you can't do that,
patting each
and it's
other on
hard.
the back and high
Hmm.
fiving each other. And it's a very congenial work environment. And we can't do that anymore. And we have to love from far away.
That's right.
And even with our patients, we have a very congenial relationship as an OBGYN. And, so it's hard to not be able to. So what I do with my visits, I tell the patients, I just want to see your face. Just show me your face and put your mask back on, so that because there's a disconnect there when you're seeing your patients. You've got a mask, they've got a mask, and especially if it's a new patient,
Right,
you want to
right.
put you want to get that sense of, you're welcome here, and I want to take care of you. And so I do that. I said, just, quick, I'm gonna show you my face, and you're gonna show me your face, and just don't cough. And
Oh my God.
I
Oh yeah.
again, having had this, I feel better. Okay, if somebody coughs, it's not the worst thing in
I
the
know
world.
you're
But
okay. We hate
not
you.
that I'm advocating going around coughing, but at least if they cough, I'm like, well, I'll be okay.
But I think, and I
Um,
mean, and
so
and I think that's actually more of the stigma, unfortunately, is that you start coughing or what have you, you do see a whole
yeah.
nother side of people. I mean, we had one poor patient that came in because, of course, it's hot in Florida. And so the poor woman, I think her air conditioning was out in her car and she was rushing around and she came in and she registered a fever. Oh my God, I thought my front office girl was going to jump right out of her skin. She almost basically, if she'd had a gun, she probably would have pulled it out and, get out, And so, luckily, we were like, okay, wait a minute, let's just give it a second. She's like, I'm just hot, wait. And so he came down, but it's a natural panic. So when people, it's like,
Yeah.
people realize, that you can't be coughing, you can't be sneezing because it's scary. It's scary. And so, you do what you got to do. I agree with you. We are our office actually, we keep the doors open to and from the waiting room. We have no one in the waiting room. And we just, same thing. Everybody goes into an exam room. Nobody but one person checking in or out at the same time. So if I see somebody at the desk, I will tell the other person, you stay in this room until we tell you to come on out, so that we don't have interaction. And the patients are great. I mean, I really haven't had any issues with that. I mean, I have a couple of people
Mhm.
that once again don't like to wear the mask, like Miss Beth, but she hasn't been in the office. But so if they're not wearing the mask, then I just say you need to pull your mask up. It's normally they're wearing the mask, but they're not wearing it correctly. And so I just kind of say,
Yeah.
go ahead and pull the mask back up or what have you. So we haven't had any issues. I think that at least in my client population, everyone seems to be on board, and that's where the great thing with the telehealth. And so the good thing is that most of the new clients that I'm meeting, I'm actually able to meet with them via telehealth first, and so there's no mask. Yay! But I agree with you. I didn't even think about that. So thank you for bringing that to my attention, because I have had a couple of new patients in the office, and I haven't thought to kind of like pull the mask down so they could actually see that I'm a human being behind the mask.
Yeah.
So I like that. I
I
like
think,
that.
yeah, it's a nice human touch. Just acknowledging, and I think also just addressing the anxiety that's out there.
Right.
It's a lot of anxiety. It's a lot of anxiety.
It is,
And
and that's what
everybody,
and
we
that's
don't know
why
what
you
it's
need
going
to
to
reach
be.
out. And that's the first question out of my mouth when I'm doing a telehealth, when I'm doing any visit. The first thing I say to my client is, "How are you?" Very good, Beth. I'm messing with Beth, but anyway, about her mask wearing. But that's the first thing out of my mouth is, "How are you doing? How are you handling it?" Because if you have underlying anxiety or depression, this can be just overwhelming, and so you don't have to live with this. You shouldn't be at home suffering. Don't suffer. I had a client today, and she said she has an online counselor, So everything's online, and so you can do these things. Reach out to us. If you're scared, if you're petrified, you don't want to leave the house. Guess what? Telehealth. So are you guys doing telehealth as well?
Yes, we are.
Yeah,
We
and so
are, and it's been a blessing.
yeah,
I really enjoy it. I feel like some minor thing. I mean, it's a little. Our field is a little tricky to do telehealth, but we can do a lot. We can do a lot.
right. But
We
it
can do
doesn't
a lot, and I
replace,
like it.
yeah. And you can be seen, though. That's what you need to know, is that the offices, they never really were shut. The physician offices were not shut. I mean, maybe I'm making too much of a global statement, but I believe the majority of the physician offices, we never closed completely. We decreased our number of days and our hours, but we never shut the doors completely. And so you can be
Here
seen.
in New York, quite a few physicians are
Did,
still closed.
oh, they did. Okay.
And I think they're the private groups, the private solo practitioners who are trying to figure out how to make this work for them.
Okay.
Some of them are older and themselves
Okay.
don't want to be exposed
Right.
to COVID-19, and so they're looking to see that these numbers go down. So we're doing. I know that I'm doing a whole lot more general medicine, filling
Yes.
of prescriptions for people to get tie them over until they can see their primary care doctors. And I mean, I love it. It's fine.
Yeah.
Understanding that people are afraid. So there are people who should come in and they're afraid to come out.
Right.
So, it's an adjustment, but
And that's the
it's been
thing. So
good.
reach out. So like you say, if you can't reach your primary care doctor, but you have an OBGYN, reach out to them, or reach
Call
out,
us.
even if it's your rheumatologist. I mean, we can all write prescriptions.
Exactly.
And so, I mean, as long as it's
Yeah.
not for a narcotic or something, you probably would find that whoever you're reaching out to, if they know you, would be willing to even refill your blood pressure medicine for
I've
you or
filled
something.
I've filled many prescriptions, even via telehealth appointment, because I have telehealth, but some of the doctors are only really dealing with emergencies. Not a lot of them are dealing with telehealth either.
Right.
They just felt like it's not they're closed and they're closed,
Yeah.
and so yeah, I've been writing for dermatologic creams and
Mhm.
lots of thyroid medication, as long as it's a patient that I know. And
Right.
what's the beauty of being interconnected through the electronic medical health record is that I can often get in contact with their pharmacy.
Yes.
And so I can contact the pharmacy because they're using the same pharmacy for different docs. And I can just say, what are they taking? And, so I'll call in a refill, or I'll send it electronically for them. Sometimes I can see,
Right.
all that they've been on, and I can refill it for them. So we have to help each other, and we have to do what's right by our patients.
Yes.
So we do.
Yes, I know we've come up on our hour, so I appreciate everybody hanging in there. If there any,
Wow.
yeah, I know, right? It's a little bit after 5. If there are any last minute questions, throw them out right now. If not, you guys can always post them, and either myself or Dr. Fils-Aime can get back to you with that answer. But I am so thankful that you came on. And I think that we had a really good,
Thank
informative
you.
session, guys. And I will see you next week. Next week, I'm actually got a young lady that's going to join us who is a COVID-19 survivor right here in Central Florida. So like I said, I'm trying to divvy it up and kind of show you different people and what different people's experiences are, because that's the other thing about it. Everybody's experience is kind of different. It's not that okay, I get COVID-19 and boom, this is exactly the course that I'm going to take. And so that's kind of one of the things that I'm trying to get across. So I think that this was fantastic. I thought I learned some stuff, and I love learning new things. And bye bye. And so we'll see you guys next week. And remember, like us, and have a great weekend, and be safe as we go into Florida goes into our 50% reopen. Take care, and thank you so
Good
much
luck.
for coming on.
Thank you.
Okay, bye bye, guys.
Bye.